Hi guys, I am a dental surgeon by profession. My name is Dr. James Lowe, and I have been in my profession for the past 47 years, and I'm still practicing. I will be turning 72 years old this June 2023. Getting older is a big subject, an interesting subject, at least for me. What I can say for myself is this. At 71, when I look out towards the world, not much has changed from inside of me because I can still do most of the things I did in the past, like hiking, swimming, cycling, jogging, and even running full marathons. In the last 3 years, I did 3 marathons. 2 marathons I did were virtual marathons during the COVID years. And last year I did the real thing. But when I look into the mirror, and I think some of you agree with me that lots have changed. Firstly, cheeks have sagged, the lines have become more prominent. Then there are those old man spots, they call it old man spots. And there's of course the thinning of hair, graying of hair, and no hair. These are all evidences beyond an iota of doubt that we and I have grown older. Notice I say getting older and not getting old. I want to make the distinction for the sake of comparison and understanding issues. So there are indeed lots of differences between getting older and getting old. I have attended to 4 generations of patients. If I consider those who were born in the late 40s and early 50s as the first generation, then this generation, they have children, and the children have children, and the grandchildren have babies, so it's 4 generations. So I have a lot of opportunities as a keen observer of generational changes, especially in aging. I still attend to some first generation patients in the 80s, and they are still normal in almost everything they do, albeit a bit toned down in the high intensity activities, but they keep themselves busy, exercising regularly, cooking for their family, and so forth. Then there are some in the 60s, 70s who got really old. Arthritis, cervical spondylitis, L4, L5 spinal disc herniation problems, diabetes, heart issue, depression, extreme fear of getting cancers, cognitive issues, phobia of learning new things. Some resign to the fate that their days are numbered and choose to be passive and broody. Some age-related ailments can be reversed, some can be mitigated, some can be managed even without long-term medication. Older persons in this discussion I consider as healthy elder people. These are the motivated ones to stay healthy and relevant, eating right, living right, and keep doing things that benefit them and others. I would like to quote Lee Kuan Yew, quote and unquote Lee Kuan Yew, past president and the late Lee Kuan Yew, one of my heroes. And he said this: if a time comes when a person doesn't need anybody and nobody needs him, is done for and how true it is. Old persons I consider those not healthy. This may have resigned to accept that they're old and irrelevant. This, in my view, does not have to be so. A significant reason may be due to misinformation about health and healthcare, and a lack of self-motivation due to emotional or psychological malaise or even depression. To be older or old, as I defined it, really is a choice. And if we start young, success is clearly better. At this point, I would share a situation that happened to me in my early 50s, which was a wake-up call. My two daughters started in Singapore, and we make trips to visit them, and I always prefer to drive. In one of the trips, I was so tired and sleepy that I could not keep my eyes open, and I would have to stop 3 times to rest before I can complete the journey. I knew something was wrong. And looking back, and I think some of you may have observed that people in the mid-40s and mid-50s tend to put on a bit of weight, or some plenty of weight. And this is a time when, the metabolic rate becomes slowed down, and people are have security at work and financially maybe stable and able to provide for the family, and then they start to relax and enjoy the good life, so to speak. And then they develop health issues. And around the same time, I realized that my eyesight was deteriorating. We bought a new car. A brand new car should be having very bright, clear headlamps. But I was finding the car headlamps not sufficient. And then I asked my family members, and then they say, no, it's a new car that is very bright. So I knew my eyesight was also deteriorating. And the thing about our small organs like eyes and ears and all that, the blood supply, the vessels are very small, tiny and narrow. And if the heart is not strong, it doesn't have enough pumping strength to push the blood sufficiently to these kind of organs, and so there's a lack of oxygen and nutrition, and these little organs tend to deteriorate. So from henceforth, at that time, about in the early 50s, I started to get active, exercising and doing a lot of crazy things. We climbed Gunung Dahan, we climbed Mount Kinabalu, and we climbed two more mountains that are in the top 6 highest, and did a lot of crazy things, but we reap the benefit of all, because right now we feel really healthy. My aspiration for the rest of my life is to be an agent for public good, and in this area of geriatric challenges, I believe I can contribute something. My inspiration to dive into this is actually quite hilarious. My younger daughter has friends whose parents passed on too early in the 50s, 60s of terminal illnesses, and you can imagine pain. Is quite empathetic. We are quite empathetic to people who pass on this way. My daughter, of course, she's affected by this. So the discussion about dying, the subject of dying, sickness and health, becomes an open topic of discussion, and we have no taboos about this. Then this joke came up In a wake where the living gathers to send off the dead, nice eulogies are often given or parroted, like he was a good man and blah blah. I say that in my wake, I won't like this because if anyone exaggerates my virtues whilst alive to hyperbolic levels, I won't be able to refute it. I said in my spirit, I probably be hovering over my body and I would have overheard all this, but I can't do a thing about it. So that was quite funny. So I purpose to die a healthy person. My daughter was puzzled. How could that be so? Surely, she said, I would be sick before I die. I said, no, I will work towards dying healthy. That means I'm looking for sudden death, which means if I die suddenly, rejoice. Do not grieve. It's the best way to go. Recently, I brought up this same subject to a colleague of mine who is contemplating of retiring at 60 years old. I told him 60 is too young to retire because with your years of experience, you are still valuable to your patients. His argument against my suggestion of dying in health is that if I keep myself healthy and die in health, then it's a waste. What's the point? So I said, it's not a waste because we die anyway. Whether in health or in sickness, we die. Dying means the time comes when our organs fail and we die. So I'd rather die suddenly without pain than to be lingering and hoping to die and won't die. And that to me is a curse. You may have heard of the Hokkien saying, Pai si boi si. In translation, it means want to die but cannot die. To die in sickness and pain is really not for me. I cannot determine the day, the time, of course, but I can keep myself healthy indefinitely until I die. And one of the greatest good that we can do to our family members is that we remain healthy and do not be a burden to them. That itself, we are actually blessing our children. I'll be doing videos following this introductory episode regarding mostly healthcare issues, and I will raise certain issues that I observe, which people do a lot, believing that it is healthy to do and benefiting them in their longevity and all that. One example I can give is that some people just drink too much water. You have these types that always have a bottle of water with them. They're always drinking. They feel that it cleanses the system and it cleanses the kidney and things like that. And all these theories are given by self-appointed gurus of health. Drinking such excessive amounts of water is actually harmful. And then there are the supplements. Healthy people do not need supplements. Only sick people do. Now, the two greatest killers are cardiovascular and cancers. And the third is arguably prescription drugs. Now, think about it. If you are prescribed one drug, likely you would have side effects. And if you are prescribed a second drug, will also have possible side effects. But two drugs can create a third problem because the first drug and second drug may interact with each other and produce a third chemical, and you do not even know what it is and what it will do to you. So prescription drugs, unfortunately, is the third largest killer, and it is $1 billion industry anyway. So if you liked my vision for this channel, please click subscribe and like so that you will be notified. I will post video once a week, and we discuss a myriad of topics to guide everyone into good health. And I would appreciate your input. You can write comments and give your share your experiences, and just give your advice so that we have an open discussion. And I believe we will come to some kind of consensus as what is healthy living and what is healthy eating, and that will be good for all of us. So until we meet again, thanks for watching.